welcome to the 4th episode of Doc Talk Live, a health show brought to you by Dallas Renal Group in association with Zyga Healthcare Group and Fun Asia. We are live from the studios of Fun Asia Radio in Dallas, Texas. My name is Dr. Leonard Goldenstein, and I will be filling in for Dr. Samir Nangio and co-hosting today's show with Dr. Perrin McKinney. Before we start today's show, we would like to introduce our sponsors for bringing the show to you every Monday evening at 5:30 p.m. Zyga Healthcare Group has been a leader in providing home health care and hospice-related services throughout the entire Dallas-Fort Worth Metroplex. Later in today's show, we will talk about the services that they can provide to patients related to today's topic of discussion. Our second sponsor is Dallas Renal Group, a physician group that Dr. McKinney and I both belong to. It's dedicated to providing compassionate kidney care to Dallas and its surrounding communities. For more information about our practice and how we can help you with kidney-related issues, please visit dallasrenalgroup.com. That's Dallas, R-E-N-A-L, group.com, or like us on Facebook.
This is Dr. Perrin McKinney, your co-host for Doc Talk Live. I want to officially welcome Dr. Leonard Goldenstein, my co-host today, as this is his first time hosting. Also, to all of our listeners, we truly appreciate your positive comments and support since our show began approximately 4 weeks ago. And we would like to continue to hear your comments and suggestions on our website, DocTalkLive.com. That's DocTalk live.com. You can also find more information related to the show on the website, including all the contact information for our experts who come on the show. With your continued support, we will continue to bring on doctors from various fields of medicine to discuss a topic every week that is utmost important for your health. Last week, we had a great discussion on cancer and cancer awareness with Dr. Sergio Aguela and Dr. Atisha Manhas from Texas Oncology. Their office details can be found on the DocTalkLive.com website. Today, we'll be discussing another very, very important topic, and that is pain management and advances in managing pain.
But before we dive into today's show, we wanted to take an opportunity to answer a question from one of our listeners that was submitted through the DocTalkLive.com website. The question is from D. Kirby, who is 65 years old. I'm not sure if you're listening right now, but we will send you the response in an email as well. But her email was, I've been having morning hypertension with blood pressure of 155/95 with some dizziness. I'm currently taking lisinopril 20 milligrams once a day. I'm also diabetic and I'm controlled on metformin. My doctor raised the dosage of the lisinopril to 40 milligrams, but it made me nauseous. I stopped the higher dose and have gone back to the original 20 milligram dose. Any thoughts? And this is a great question. It's actually very true that for almost all blood pressure medicines, the side effect likelihood goes up with the dosage. So a person who's taking a higher dose is more likely to have a side effect than someone taking a lower dose. And it's also true in the reverse, that when the dose is reduced, the likelihood of having a side effect goes away, or as in this case, someone who develops a side effect can have it go away when they reduce the dose. However, I would suggest that you talk to your doctor about the change that you made. The blood pressure before the change was made to your medication is really too high based on today's national standards and exposes you to some risk of high blood pressure and damage from high blood pressure. Your doctor may need to add a second medication in order to control your blood pressure without causing side effects. And this is very common where we'll sometimes have to use lower doses of more medicines to control blood pressure but avoid side effects. Dr. McKinney, any other thoughts?
I completely agree with you. The only other thing I would like to add is I would highly recommend you check your blood pressure at least once a day. Keep a record of it so you could take it to your doctor's visit and they could kind of look at the pattern, the trend of the blood pressure. But that was an excellent question, and thank you for submitting to our website. The number to the studio is 972-235-5555. Again, that number is 972-235-5555. Our invited guest will be answering your question throughout the show today regarding pain and pain management. Today we have Dr. Nina Sandhu and Dr. Rahul Mishra from Texas Pain Relief Group. They're practicing pain management doctors in the DFW area. Welcome to the show, and thank you very much for volunteering your time to speak about pain management. Before we start, please tell us a little bit about yourself and your practice.
So, good evening, everyone. My name is Dr. Nina Sundhu, and I currently practice in Frisco, Texas. Dr. Rahul Mishra and I both work for Texas Pain Relief Group, which is a group of about 13 physicians in the Dallas Metroplex that focus on pain relief and, more importantly, changing functionality and changing people's lives. Brief background about myself: I am originally born and raised in Ohio. I did medical school, undergraduate, all my training at the Cleveland Clinic Foundation in anesthesiologist and pain management, and took a leap of faith and did an amazing job in Dallas, and I'm very thankful that I did so.
Thanks very much for having us. My name is Rahul Mishra, and Dr. Sandhu and I both are part of a really exciting group. Texas Pain Relief Group has really phenomenal physicians that help treat all kinds of pains, all kinds of patients with various backgrounds. So I'm very fortunate to be with the group. I've actually grown up mostly in North Carolina, moved here, and then my wife and I settled down, and Dallas is now our home, so we're very excited about exploring a new city. And our clinic offers a variety of different types of treatment, and I'm really looking forward to being able to help the Dallas-Fort Worth area any way that I can.
Excellent, thank you. We're going to be taking calls in a few minutes. The number to the studio is 972-235-5555. Before we start the topic today, we have received several questions from our listeners through the DocTalkLive website on today's topic. So we'll be incorporating those questions and have those answered through our discussions. So we had a couple of interesting questions during the break. The first question was from Miss Sophie. She is a 27-year-old female, and her question was she's been having this backache, which was started or diagnosed about a year ago, and was diagnosed with as a misplaced and herniated disc. She tried the physical therapy route, the conservative route. She tried the corticosteroid injections, local injections, and everything. But there hasn't been any resolution to her symptoms. And her question is, are there any other options? And if so, what are the long-term effects of those medications and or this back pain?
So, thank you very much for your question. I think this is something that everyone can relate to, as herniated discs are very common in society. The good news is, because you're 27 years old and this is a relatively new injury per se, your body's ability to heal itself is almost exhausted. Given that said, it's really hard for me to offer a treatment plan without physically examining you, as well as getting into your mind. The reason why I mention this is because I really don't know what that disc is mechanically destructive, if it's something anything at all. For instance, if your disc is touching on anything that's spinal cord or if it's touching a nerve, then that kind of gives me different ideas of where this thing is coming from. The fact that we did fail a series of steroid injections does not mean that all focus is with interventional or procedure therapy. It just means that we maybe need to be a little bit more specific in what exactly that steroid is going to do in your body. With all herniated discs, most commonly they occur in the low back, and conservative therapy is recommended because oftentimes your body has the capacity, as I discussed, to heal itself. Now, when you failing, so when we talk about interventional therapy as well as medications, I'm not quite sure if we will try any medications, but I usually incorporate a non-narcotic therapy, which means that no addictive medications, no opioids per se, that mask the pain only to relieve pain if needed, but also no stabilizing medications, as well as other FDA-approved medications that help with the pain. Now, are there any side effects of these therapies? It just really depends on what's included. Physical therapy, I would recommend for everyone. It's just exercise. It produces dopamine, which is that feel-good hormone in your brain. It's your body's natural pain reliever. And, that is something that everyone can try after their doctor's permission when starting exercise regimen. As well as other side effects of therapy. Every medication will be tailored to from a specialist, and that's something that we can work on the side effects, and each one is going to be different because of that. As far as the steroid injection is relatively safe in experienced hands from a pain management physician, and again, it's appropriate for you to talk to your doctor about what specific risks that is going to occur with that. Anything else to add, Dr. Mishra?
Well, I'm going to ask Dr. Mishra the next question. Mr. Muhammad called, and his question was, he was diagnosed with L4, L5 area moderate stenosis, and he's been on some pain medications. He's also been on physical therapy and some stretching exercises. Now, his question is, are injections recommended, and if so, what type of injections?
That's a great question. The term spinal stenosis is used quite frequently, and that is also a common finding. Basically, that is a narrowing of the spinal canal, and to what effect that has on a patient is really individual. One person could have a significant degree of stenosis and still have no pain. So the degree of stenosis and how much pain you have will not necessarily correlate with perhaps another patient's MRI. The reason I mention that is because the pain treatment will, on the same level, have to be individualized for what kind of symptoms you're exactly experiencing. If other than pain, other than physical weakness, also have to see what other medications did work. And there are actually other therapies available to help that beyond just injections. And that's something that I would recommend you speak with your physician about, your primary care doctor, to see what pain management specialist can help you out. Question, and I think in the elderly, joint pain is quite common. There are a lot of pain modalities available that are considered more minimally invasive, and even conservative therapies that can help augment good function without having to experience that pain. I think the first thing that we have to look at is, of course, functionality. How well is a patient able to go through their activities of daily living with the painful joint? We like to work with our orthopedic surgeons in conjunction and figure out the best treatment plan. Sometimes a joint replacement is indicated given how much degeneration there is on the joint, but to answer your question, there are a lot of treatment options available that are non-surgical.
So healing can come from a lot of different things. One is from possible diabetes, and high blood sugar can cause nerves in the foot to cause a shooting pain. Because it's located in your heel, and you mentioned that it's more so physical activity or exercise, one thing may be a possibility, and that's something that's called, that is a little bit of information about the foot in layman's terms. And in that case, it may just need more conservative therapy where, stretching that fascia or, the muscle layer underneath the foot, as well as possibility of looking at options that may be possible, such as the diabetes, as I said. At the point that we have tried these different modalities and have seen not to get pain relief, it would be a good time to ask your primary care doctor if some pain management specialist would be right.
It's interesting that you brought diabetes, because a few weeks ago we discussed with Dr. Forden and Dr. Garcia about diabetic nerve pain, also called diabetic neuropathy. Can you tell us a little bit more of a treatment option, whether it be medication or intervention, in regards to that?
There's a lot of treatment options that are actually available for the pain management physician, both medication and intervention. Of course, it all starts with promoting health, what Dr. Sandhu had mentioned earlier on. The body does have an ability to heal itself, but it is also always trying to preserve strength and trying to preserve its functionality as best as possible. So our first goal is to work with the patient's physicians to make sure the diabetes is under control. As when that is under control, then we can start to see some of the fruits of some of the pain management modalities, including medication and interventions. Sometimes pain modalities do not work as well if the underlying disease process has not been properly addressed. So we like to work with our primary care physician colleagues and specialists to see if we can optimize that treatment plan. And as far as the symptoms that you're talking about, it could be one of many underlying things that may not be a specific disease related. It could be low blood sugar, it could be just a low blood volume. Sometimes patients experience these symptoms just based on weather changes alone. It sounds to me that this is something that your primary care doctor can refer to a pain management specialist, and they can give you a very good differential. And something like that is something that we see in our clinic, and those are those patients definitely have some treatment options to help you out there. That's a great question. Thank you.
We're having a great discussion about pain. We have Mr. Sadiq Nair from Zyga Healthcare Group in the studio with us. Can you please tell us what services are provided by Zyga that can help manage pain?
Thank you, Kareem. There's a lot of things that Zyga Healthcare can do. One of our main focuses is home healthcare. So as Dr. Sandhu and Dr. Mishra was saying, a lot of these things are preventative medicine and giving physical therapy and medication management. And those are the services that can release it to it. For example, if there's a patient that has, for example, when do you go and see your doctors? At least once a month, maybe once in 2 months. So we become the point of contact for the patient, for the doctor, because we come every week and check your blood pressure, your checks, your medication management, everything says that. And that's how we service on making better for us.
Well, we're approaching the end of our show. Remember to log on to our website, DocTalkLive.com. That's DocTalk live.com to submit questions for next week's experts. Dr. Sujit Acharya and Dr. Carrington Mason, who are practicing neurologists, will be discussing men's health, including prostate issues.
Dr. Sandhu and Dr. Mishra, thank you very much for coming on our show. Listeners, so you could get more information on their show on Doc Talk Live website. Dr. Leonard and I are signing off with yet another episode of Doc Talk Live. See you next week at 5:30. Stay healthy, Dallas.